Good morning, afternoon, evening, ladies and gentlemen. We would like to welcome you all to the Korea workshop of the 19th International Anti-Corruption Conference. And thank you so much for joining us despite your busy schedules. My name is Kim Yeonjin, your MC for this session. It is my great honor and my pleasure to meet all of you. Before starting our session in full swing, I'd like to give some information to all of you. In the studio in Korea has been complying with all the requested COVID-19 quarantine measures required by the government. And this session, we're going to talk about the theme of transparency and trust on the administrative process in regards to prevention of COVID-19. I guess this subject is very timely thing, and I think everyone will be interested about these subjects. So I hope you grab some ideas during this session. So if you have any questions or comments, so please feel free to leave them in chat window. Now I'd like to introduce our moderator, Ms. Ryu Hyun-suk, Senior Research Fellow of Korea Institute of Public Administration. So Ms. Ryu Hyun-suk, the floor is yours.
감사합니다. 소개글 해주셔서. 네, 안녕하세요.
Thank you very much for introducing me, and I'm the moderator for this session. My name is Ryu Hyun-suk. So I'm very happy to see and proud to see the opening of the 19th IACC in Korea, and I'm very honored to be part of this important conference. Today we are going to talk about the COVID-19 related disinfection and prevention, and we're going to talk about the importance of transparency and trust. So we will listen to many different opinions from the Korean organizations as well as the international organization, OECD. I believe that this will be really valuable opportunity for all of us. We will share presentations to learn from each other and to be better prepared and cooperate further for the purpose of anti-corruption in the post-COVID-19 era. And we will now move on to the presentation. So the first presentation will be given by a person who is leading the COVID-19 disinfection in the Korea Disease Control and Prevention Agency. Director General Baek Young-taek of Planning and Coordination will talk about our experiences in COVID-19 disinfection.
She has been involved in this public health affairs, and he also has led a mega project in this area. So now, let me invite Mr. Bae for his presentation. Hello, my name is Baek Young-taek from Korea Disease Control and Prevention Agency. I'm very delighted to be part of this big conference, the IACC, and I'm very honored to share with you Korea's response to COVID-19. And especially, the theme of this conference is truth, trust, and transparency. When we are coping with COVID-19, this theme goes well with the theme that we pursued. So let me first talk about our past situation. Korea's first COVID-19 cases was reported on January 2020, and we expanded our capacity for treatment. And if you look at this graph, we have faced actually 3 crises. The first was in February and March, when we experienced big outbreak in Daegu and Gyeongbu area. At the time, we didn't have enough information about COVID-19. And especially when this outbreak occurred, it was closely related to a religious cluster. And the group who were who are confirmed argue that they are being assessed heavily by the government to arrest them. And the government also carried out various activities to dispel such suspicion. If we are able to successfully contain that outbreak in February, we were able to have a successful result in coping up with the COVID-19. And as I said earlier, we had three big crises when it comes to COVID-19. And for the past 10 months, we have about 35,000 confirmed cases, and we have 526 death toll. And if you look at the current situation, since November 1st, we have about 5,600 confirmed cases. And I believe that it is coming from some, it's not coming from some large cluster, rather it was from some sporadic small clusters and cases. So I think it is time for a general public to more closely follow what the government is trying to pursue in containing COVID-19. And when it comes to a countermeasures for COVID-19, we need to think about our past history when we experienced MERS-CoV outbreak. It originally came from a camel from the Middle East area, and at the time it was a news to me. We didn't have any information about MERS-CoV. So we weren't ready to deal with this new disease. So we were heavily affected by that experience. And there was one patient who infected with MERS, but the government failed to disseminate that information to the general public in more detail, and it increased some mistrust or distrust among general public. And we also carried out WHO and RK joint mission on MERS, and we came up with some recommendations. The first one is about identifying and monitoring case contacts. And also, we need to be more thorough in conducting a tracing of the contacts. And second recommendation is timely and regular sharing of information with the public. And the third recommendation was that based on those recommendations, we need to expand and strengthen the capacity of medical facilities and laboratories. And based on those recommendations, since 2015, the Korean government made a lot of preparation. So what the Korean government did is strengthening some quarantine process at the airports. And we do have also introduced EOC, the Emergency Operations Center, which run 24/7. And for the quick response, we also came up with the initial response group. And to enhance our capacity of clinical tests, we also improved that area. And we also came up with the good communication processes and systems. Based on the risk assessment, which is conducted in a scientific way, risk communication was actively pursued. And based on this, the general public, at the metropolitan government in local area, started to be active in engaging in various policies of the government. And what I'd like to point out is that before COVID-19, in order to cope with this new type of disease, we expanded a national laboratory across the nation, and it was very helpful in dealing with this new disease. So we have basically three principles. One is openness. So when we had first case, we didn't close down our border, or we didn't carry out lockdown, although there are many people who said that maybe we need such measures. But by consulting with the professionals and experts, if the government have its own principles, with openness, we can successfully contain the virus. So that was the basis of our government policies. So in fact, we had a general election on 5th of April. And while we are still experiencing COVID-19, having this type of large-scale general election could be seen as a risky activity. But while we are thoroughly following the COVID-19 preventive measures, we're able to successfully carry out the general election. So next core principle is transparency. We put a lot of effort to enhance transparency, and within the transparency, there are three sub-values. One is, in Korean saying, there's something good that is done by left hand shouldn't be shared with the right hand, literally. So how can it be translated is that one government agency's good deeds were not shared with other government agencies. But when we respond to this COVID-19, we encouraged all different government agencies to join forces together. And we also had a regular briefing so that all important information can be shared amongst different government agencies and organizations. So that was our policy direction. And the other sub-value of transparency is the transparency toward a general public. So there were two important figures who conducted the daily briefing. One person was Ms. Chung Eun-kyung, the head of the Korea CDC, and she delivered all scientific and trustworthy information 11 a.m. every day. And the other person is a guy from Ministry of Health and Welfare, and he focused on what kind of government activities are being carried out to contain the virus. And there might be a lot of concerns and unanswered questions. So that's why we came up with 1339 call center, so that we get all different types of queries from the general public and reflect some of general public's idea into government policies. So we carry out various types of activities and providing a good information. And that way, we could allow general public to trust more toward the government. And while doing that, the government also asked general public to thoroughly follow the government policies, like wearing masks all the time. So based on these three principles, in dealing with the COVID-19, we are able to have a good result to some extent. And when it comes to methodologies, we focused on 3T strategy: evidence-based, science-based policies were made, and to provide that information with the general public, we continuously enhanced our testing capacity. So as for the PCR testing, the capacity is 110,000 per day. So temperature, high temperature, or the respiratory symptoms, if such symptoms were shown in some people, they can go to the nearby test center and get tested in a very short period of time. And by utilizing various IT technologies, we conducted contact tracing. Korea is known to have a very good IT technologies. So using mobile phone location tracing technologies, we were able to trace a contact of the confirmed people so that those contact people can undergo some testing. And what I'd like to stress here is that based on the advanced IT infrastructure, Korean people were able to get various information, and we tried very carefully that the general public's privacy is not infringed. And that was possible thanks to the introduction of the related laws and regulations. The other aspect is about treatment. Once some people get infected with the coronavirus, we put them into 4 different categories. If they are falling into severe or extremely severe, they could go to they can be admitted to a negative pressure unit. And if the confirmed cases fall into mild or moderate categories, they can be admitted to not a typical medical center, but a place where they can be treated fairly well. So that was the treatment system that we introduced. So the Korean government, including Korean Disease Control and Prevention agencies, carried out various measures to tackle COVID-19. And just like the theme of this IACC, the Korean government tried to make a policy based on science, and those policies were well shared with the general public, and that helped improve the public trust toward the government. And also, the transparency, openness have always been the principle of the various government policy when it comes to COVID-19. And all these ideas were well agreed by many government organizations. With that, I'd like to wrap up my presentation. Thank you for listening.
Thank you very much for the presentation. So you explained about the non-transparent communication and information sharing that we saw during the MERS outbreak, and we learned from those experiences. And after a few years, we built up transparency once again in communication between the government and people. And then you have talked about all these cases that we actually saw on the site. So thank you very much for sharing. And we will move on to the second presentation right away because of the time limit. So the second speaker has worked in the OECD Policy Center until last year, and now he's working in the Ministry of the Interior and Safety, and he's the Director General of Societal Disaster Response Policy Bureau. So the second speaker is Mr. Lee Han-kyung, and he's going to talk about South Korea's response to COVID-19, transparency, engagement, and innovation. Please go ahead.
Good afternoon. I'm Han Kyung-hee, Director General of Societal Disaster Response Policy Bureau in the Ministry of the Interior and Safety of the Republic of Korea. The global community is now waging a war against COVID-19. The entire humanity is in a crisis. This country is struggling to overcome the pandemic, but no one knows when we will reach the end of this tunnel. South Korea is trying to find the answer in the transparency of the policy process, trust from and engagement of our people, and innovation. Now, I'd like to share some Korea's examples in this regard. This is how I structured my presentation today. I will start by talking about the Central Disaster and Safety Countermeasures Headquarters meeting, where transparent policy process takes place. And safety report in which our citizens play a major role in preventing and controlling COVID-19 based on their confidence in the government. Then I will introduce, I will introduce a couple of examples of innovation, which are the result of our citizens' active participation and assured local government autonomy. Transparent communication between government agencies that respond to disasters is key to successful response. And the result of the communication should be shared with the public in a fast and accurate manner. Only then you can win the public's trust and engagement. Let me briefly touch on how the CDSCH is organized. The Prime Minister who oversees the national administration had the meeting. The Ministry of Health and Welfare and Korea Disease Control and Prevention Agency, who are in charge of COVID-19 response, lead the Central Disaster Management Headquarters and Central Disease Control Headquarters, respectively. In order to support these disease prevention and control bodies, the Ministry of the Interior and Safety is in charge of coordination work between different government agencies by heading pan-government countermeasure support headquarters. Last but not least, 243 local government are the members of the Prime Headquarters, which basically means that all the stakeholders of the national administration become the part of this organization. Let's take a brief look at the roles and responsibilities of each body forming the Prime Headquarters. Central Disaster Management Headquarters, Ministry of Health and Welfare, draws up plans to respond infectious disease and issues and spread emergency alert. Central Disease Control Headquarters, Korea Disease Control and Prevention Agency, develops and manages response guidelines, conduct epidemiological investigation, runs the communicable disease surveillance system, and provide and manages supplies for disease prevention and control. Pan-government countermeasures support headquarters functions as a coordinator to make sure the entire government support the disease prevention and control bodies by managing those under home isolation, securing sites for temporary treatment centers and temporary housing and operate them, declaring a national emergency or a special disaster zone, among others. Cooperative governance is essential for a successful disaster response. MOIS, our department, works as a governance facilitator in the process. Finally, we have local government who are the first responders to carry out activities to prevent and control disease on the front line. They play the most critical role. In this prevention and control by implementing various on-site activities in line with the policies and guidelines of the central government. In South Korea, importantly, local government have the autonomy to develop and implement their own innovative initiatives under the leadership of the head of each institutions. The first confirmed case of COVID-19 in Korea was found on January 20, and the Prime Headquarters began its operation on January 23. Since February 25, Prime Quorum meeting take place on a daily basis. Representatives from the entire government ministries and agencies, as well as local government, It has 17 metropolitan cities and provinces and 226 cities, counties, and districts take part in these meetings. In other words, we run an online communication channel in massive scale. I think the scale would be as big as this workshop we are having today. Each government ministry and agency evaluate the current situation, discusses disease prevention and control measures, and how local government can help, whereas local government report on what's going on the ground and the challenges they face in implementing disease prevention and control measures. Presided by the Prime Minister, all the participants discussed the issues and suggestions raised, and as it becomes clear, the ministry and agency in charge of the item shares its opinion. The majority of issues and suggestions are accepted. In addition, for whatever ministry or agency has asked to help with local government respond at the moment or will share how they have done or what they have found during the next session. Each and everyone shares their opinions on the agenda as if they have a conversation in a room. To sum up, all the heads of the organizations in charge of national administration are involved in their meeting to raise and discuss policy agenda, and then policy decisions on the agenda are made in a fast and transparent way during the meeting. After every meeting, the head of the Central Disease Control Headquarters hold a public briefing session. That is to say, it is the system where what has been swiftly and transparently decided during the Prime Headquarters meeting is shared with the public on the same day. This process can help citizens quickly learn the information about the government policy and also help making the people have their trust in the policy. What forms an integral part of Korea's disease prevention and control is how citizens are involved in the policy and how the government quickly respond to the voices of the people. South Korea uses safety e-report to make this happen. Citizens can report any risk to disease prevention and control that they have witnessed or experienced to the government via safety e-report mobile app or website. It's how the people are engaged in preventing and controlling disease as a major player. We receive around 200 cases every day for violations of safety precaution, or administrative measures and suggestions for disease prevention and control initiatives. Our rule is to handle a report and notify the results after 7 days of the recession. MOIS monitors whether the agency in charge of a case is properly handling the report and makes sure the institution to quickly take actions when a handling of a report is found to be insufficient. What is more, MOIS carries out spot checks to find issues and report them to the Prime Headquarters. Ministries and agencies in charge develop a plan for improvement and conduct overall inspection. You can see some examples in the box. Safety e-report helps improve disease prevention and control measures. For example, we learned through the report that after an order was issued to ban the operation of restaurants located in certain high-risk areas, balloon effect occurred where people gathered in large numbers in some public parks, and street food stalls, bumping into each other and crowding the space. Following up on this report, the local government in charge was able to take an improvement measure by including more places in which gathering bans are effective. The active engagement of our citizens and assurance in the autonomy of local government became the basis of our innovative measures to prevent and control disease. Cases in point are temporary treatment centers and drive-through screening stations. An idea to set up temporary treatment centers were developed in a time of crisis when some 2,300 patients with COVID-19 had to stay home due to shortages in hospital beds following surges in the number of confirmed cases in the Daegu City area. At that time, some volunteers in the medical team assumed and the government later confirmed that about 80% of the total cases would not necessarily be admitted to the hospital. The government then devised a plan to temporarily isolate and treat patients with COVID-19 in public facilities such as training centers. In the early stage, MOIS led the operation of the temporary treatment centers with other government ministries and agencies, including the welfare department with the help of medical volunteers. As a result, 45% of the total patients with COVID-19 in Daegu city area were treated at these centers, preventing a disruption in the healthcare system. Safety concern reporting helps improve disease prevention and control measures. For example, we learned through the report that after okay, yeah, I keep going. The learned through the report after an order was issued to ban the operation of restaurant located in. Yeah, I'm sorry. The okay. Yeah. The last page, please. Last slide. Yeah, okay. Last one. Yeah, I'm sorry. We have some technical mistakes. This is my last slide. The characteristics the South Korea's response to COVID-19 can be summed up as a virtuous cycle where transparent decision-making and prompt sharing of the result with the public leads to citizens' confidence and active engagement in the government and its policy, which in turn the result in a wide range of innovative measures that support effective disease prevention and control. I'm not sure if I covered all I had to say in this short time, but I hope you found it helpful. Let's get through this tunnel of COVID-19 together. Thank you.
이한경 정책관님 발표 감사합니다.
Mr. Lee Han-kyung, thank you very much for your presentation. Due to some technical issues, he had to pause. However, he delivered successfully that what kind of a policy the government carried out and how the government was able to secure trust from the general public, very in detail. Due to the time constraint, we will move on to the third presentation. The third presentation will be delivered by Mr. Kim. And you all remember that in March or April, we were able to get the facial mask fast or in a large volume. But through the private and public consultation and cooperation, we are able to went through that difficulties. So with that, I'd like to invite Mr. Kim Sang-bo, and he will talk about the stable supply of surgical masks through transparent management of supply and demand. And he's from Ministry of Food and Drug Safety. Mr. Kim, please.
네, 말씀드리겠습니다.
Okay, I will start my presentation.
말씀하신 바와 같이 마스크에 대해서
So as Dr. Liu said, I will talk about the facial masks. And while I organizing my presentation material, I came to realize that this year was very dynamic and we need to go through a lot of things.
한 해를
So I was able to
계기가 되었습니다.
have a very good time looking back what I did this year. And I had to deeply involved in this good supply of surgical masks. So I will talk about first COVID-19 outbreak and supply and demand imbalance for PPE and efforts for PPE supply. And third, I will talk about the treatment and government's transparent management of supply and demand.
우선 코로나19 발생과
First, COVID-19 outbreak and supply and demand imbalance for PPE. It has been almost 1 year, and
처음으로 아마
in December last year, we first got a report of the first case, and this year, January, we had a first domestic COVID-19 confirmed case reported. And at that time,
유지하면서
while we are trying to be cautious,
기침, 호흡기 증상이 있을 경우에
we had some infection prevention practices like wearing mask when showing respiratory symptoms and washing hands for 30 seconds with running water and informing healthcare professionals of our overseas travel history.
수급이 불안정해지는
And after that, we start to face the difficulty in securing supply and demand.
생활 백신이라고도 부르고 있습니다.
So this facial mask or surgical mask is like a kind of vaccine that can protect us in a daily life. So it has a certain level of protecting us from the virus. But with the surge in the number of confirmed cases, we need a lot of facial masks, and leading to a shortage of supply of facial masks. And some
가격도 올라가고
facial masks were not supplied and stockpiled in warehouses, and some business people smuggled the masks out of the country.
쓸 수 없는 그런 상황.
So Korean people had to experience a lot of difficulties in securing a proper number of masks.
외석 행위 금지에 대한
So in order to tackle this situation, we enacted the notification on the prohibition of hoarding, filtering respirators, and hand sanitizers. So with the MFDS taking the initiative, centers in 17 cities and provinces opened and operated to receive reports on cornering and hoarding. And also January 31st, a pan-government control team was launched,
의료 현장의 마스크 수급을
and we pushed forward with the mandatory reporting of production and sales volume as well as selling prices. And we also secured raw materials and
들었는데 그게 이제 긴급
provide enough amount of facial masks in healthcare facilities.
판매업자가
And also MFDS enacted emergency adjustment measures for supply and demand of masks.
엄정하게 단속하는 한편 사태
And we
장기화에 대비해서
imposed strict measures
생산하는 업체에
against failing to report on purpose, manipulation of trade volume data, and also to secure raw material to produce facial masks. We started to working with the different government organizations. So as you can see on the bottom of the slide, we were able to increase a production capacity.
그다음에 이제 그러고 나서 한번 또 다시 큰 변화가
And afterwards, we also experienced significant surge in confirmed cases. It was from the local cluster,
불구하고 가격도 오르고
causing a skyrocketing prices in facial masks and a shortage of supply.
정부에서는 시장에만
In light of that, the government decided that it cannot solely rely on the market, and the government decided to heavily engage in this situation. So, in order to prevent the market disturbance, we had a policy implementation for preventing acts of disturbing a facial mask, and we utilized and employed all available measures. So half of facial mask production was supplied through public retailers such as pharmacies, post offices, and the medical facilities were one of the first the group that received masks. And while we are carrying out this, we focused on three principles. And based on the effort made in the past, we were able to make general public get a peaceful mind. So we tried to increase a production, and we tried to secure a large volume of production in the short term, and we also carried a long-term plan. But what is most important thing is the understanding of the general public, so that people can make a reasonable consumption of a facial mask, and general public embraced the government policy, and they understood what they need to do. And we also came up with three purchase principles for fair distribution of masks, because at the time the supply was enough. So we had to force some purchase restrictions. So only 2 masks can be purchased per person per week. And we also introduced 5-day rotation system, so that people don't have to wait in line to purchase masks. And in order to prevent people from buying a mask in a duplicate manner, we also introduced a real-time purchase monitoring system. And in all processes, we had a very transparent information sharing. So information included mass production, distribution volumes, and major policies like purchase restrictions, and all those information was provided on a daily basis, and it targeted overall general public, so that information was provided on a regular basis. And real-time sharing of information was also available. So that way, people can ease their inconvenience in purchasing masks, leading to a stable supply and demand of facial masks. So as the government expected, and based on the general public's cooperation, the supply of facial masks becomes stable, and weekly production volume doubled, and the market prices also stabilized. So through the transparent management of supply and demand of facial masks, we are able to successfully carry out our policies. And in the beginning, some people said that we may have our market disrupted due to the unstable supply of facial masks. But thanks to our policies and thanks to the active cooperation of the general public, the facial masks were distributed to the general public easily, because we believe that facial masks can work as some sort of vaccine. And all this was also proven internally and internationally. And I'm very honored to share this information with you in this meaningful occasion. And with that, I'd like to wrap up my presentation. Thank you.
네, 김상봉 국장님 발표 감사합니다. 김 국장님께서는 그
Thank you
마스크
very
수급
much
과정에서의 어떤
for your presentation
투명한 정보
about
공개,
the transparent
그리고 공정한
information
관리,
sharing
그다음에 신속한
during
정보
the
규제,
distribution,
그리고
management, and regulation related to face mask, as well as cooperation with the mask manufacturers. Thank you very much. And because of the time limit, we are going to move on to the fourth presentation right away. And it will be given by the head of the Sherpa and Global Governance Unit in the Office of the Secretary General and South Sherpa. So Ms. Najla Saula of the OECD will talk about the managing corruption risk and promoting integrity in the context of a global health crisis.
Thank you very much, Mrs. Chair, and good evening to everyone in the studio. Thank you for having me and allowing me to participate all the way from Paris, thanks to the technological support. My presentation will be a bit broader, and I think will allow our colleagues here and hopefully the audience to step back a bit and look at indeed what the corruption risks have been identified in the broader response to the global health crisis. So both in the delivering, of course, of the health support, but also in the context of the unprecedented economic support that has been provided by many of the governments, including, of course, the Korean government. So just to give you a bit of context in terms of the magnitude of the COVID-19 crisis, it has, of course, cost millions of lives. It has also launched the worst economic crisis in the century, leading the global GDP to decline by about 4.5% this year. And while the prospects for next year are a bit more positive thanks to the very good news related to the vaccines, of course, uncertainty remains high as you know, a more positive economic outlook and projections will depend on the vaccination campaigns and continued government support. Of course, in addition to the impact on GDP, another element of the magnitude of the crisis has been, as I mentioned earlier, the amount of stimulus measures that have been taken by all the countries to make sure that, or to help alleviate the economic and social impact of the crisis on all of our citizens, to strengthen aggregate demand and improve the prospects of a stronger recovery. Governments have provided trillions of dollars in recovery packages, both in support schemes for citizens directly, but also to support companies stay afloat during the very difficult times that they have faced, while governments have taken a lot of the necessary containment measures with a significant impact on the economy and societies. We're also looking, of course, so my intervention will focus essentially on the integrity and corruption risks in the direct response of the crisis. I think this will dovetail well with my other eminent panelists' presentations on how governments have ensured a continued response to the health crisis itself. But I think it would be important, and I'd like to point that here, that the issue and the standards of integrity and the fight against corruption will also be critical as countries now are looking beyond the management of the emergency health crisis and looking to build back better, as we say, looking at the recovery that will help set in place sustainable, resilient, and inclusive growth. So looking at the stimulus packages that can create a recovery that safeguards prosperity in the long term and strengthen the resilience of our economies, of course, making sure that anti-corruption and integrity standards and frameworks are at the heart of these efforts is really critical. So I'm putting this out there while, of course, when I continue, I'll focus a bit more on the anti-corruption risks in the health crisis. So in that regard, the OECD analysis really has looked across a number of policy areas. Our goal was to help policymakers, but also law enforcement officials and the private sector to ensure that the global response to the crisis is not undermined by corruption and bribery, and to help, as I mentioned, ensure a strong and sustainable recovery, so that all the trillions of dollars that have been injected in the economy actually reach the goals and reach the people and the businesses that they were meant to do, and are not diverted either through poor or weak governance systems, lowered integrity standards, and bribery schemes to divert the funds that have been allocated. So this is the analysis has looked, the OECD analysis has looked at, of course, the public sector governance, in particular emergency procurement, which has been touched upon here as well to respond to shortages in essential goods, for instance, but also more broadly to make sure that the medical equipment necessary to respond to the health crisis was made available. But also looking at more broadly bribery and corruption investigation and efforts, which is an effort that is ongoing, that should be maintained, and whether the lowered resources, because they have been reallocated, of course, elsewhere, haven't impacted, or whether they have impacted precisely the efforts by our law enforcement officials to actually tackle bribery schemes, both in the context of the response to the crisis, but also more broadly. Finally, we have also looked at where the risks were in terms of the economic stimulus measures. So as I mentioned, the social schemes that have been taken and adopted by our governments, making sure that they reach the right recipients. So all these findings, just for your information, are on the OECD COVID-19 Policy Hub. I'll touch upon a few of these points now to help broaden a bit the conversation, but would invite you to certainly take a look at the more detailed analysis that the OECD has produced. Looking at specifically now the management of integrity risks in emergency procurement, the crisis has, as I mentioned, has meant that many countries and institutions are buying and importing medical equipment and supplies through emergency procurement processes where due process may not always be followed, or certainly the risks for lower standards of integrity because of the emergency nature of the process are certainly risks to be addressed. We all know that public procurement remains, in general, a high-risk sector for corruption. Our analysis a couple of years ago, and I don't suspect this has improved, unfortunately, shows that 57% of foreign bribery cases that we have recorded involve public procurement. So this is certainly an area which is in itself already a high-risk area, and of course where emergency settings could potentially heighten the risks for these type of corruption actions. In this context, so the OECD has carried out surveys of OECD governments, and we have found that as governments are urgently procuring large quantities of goods and services, they're using provisions that allow procuring necessary supplies either directly or via a pre-approved list of suppliers without necessarily going through the standard, even though, of course, lengthier procurement processes, which is very much understandable. As mentioned, this is an emergency situation. That said, it was important to flag the risks that procuring services and goods that do not meet quality standards, that are procured through corrupt means or both, are addressed. Public procurement legislation often provides, in fact, exceptional measures for paying ongoing contracts in emergency situations as well. So the issue was both public procurement in the context of the emergency needs, but also how to deal with ongoing public procurement processes which have not stopped and responded to the ongoing normal, I would say, needs of governments. So for example, some public procurement legislations allowed for specific advance payment or exempting suppliers from penalties for the deficient performance of contracts. Such derogations to establish practices that govern contractual relationships could also open the door to corrupt practices, which is why transparency and transparent guidelines should be communicated to all contracting authorities. So here we go back to the transparency concept, which is really at the heart of this workshop, and that from our perspective and our analysis, of course, is at the heart of the management of these risks, including in the context of emergency procurement. So overall, we've seen that the emergency circumstances often required increased coordination and enhanced flexibility in public procurement. There are a number of areas in the public sector that can have a high impact on the success or failure of current and future government intervention. Short and long-term solutions can help address these risks. For example, specific procurement strategies, allocating sufficient resources, of course, and guidance to internal audit functions. And I think I'd like to press the point that audit functions are particularly important in this context to help manage these risks, and adapting audit and oversight strategies, as well as analysis of potential corrupt patterns in relation to the COVID-19 situation is really important, in particular where bargaining powers between the public and the private sectors has been drastically reversed, including with effects on competition. So in this context, audit process and oversight is really critical to maintain. Many countries have also implemented measures to ensure transparency and accountability, including developing guidelines subjecting emergency procurement, as I mentioned, to audit and oversight, but also using existing e-procurement platforms to record transactional information. So one important element here to also help audit and oversight functions to deliver their analysis and their support properly is really to maintain and retain documentation of procurement processes. So as we accept and understand the need for accelerating the process and finding shortcuts, I suppose, to be able to deliver in time these essential goods for citizens, it's very important in our view that the basic documentation and record keeping requirements should remain and should apply to make sure that there's also an ex post verification that everything has been done through the highest standards of integrity. So these are some elements that we have, of course, analyzed and where specific guidance can be provided to governments. That includes, of course, also local governments who are faced with the need to staff and to acquire those goods. Obviously, in the context of the vaccines distribution, manufacturing and distribution, this will all the more be quite important to also keep in mind. As I mentioned earlier, the second policy area or the second dimension where we have identified heightened risks of corruption is really in the broader context of enforcement. So here we have really looked at whether the focus, the refocusing of government's attention and efforts to investigate, to addressing the crisis as it should, of course, should nonetheless not weaken the resources and the means for law enforcement officials to actually deliver on their tasks, which, as we just seen now, is all the more important to make sure that the recovery goes in the right direction. So, of course, complying with international standards like the Anti-Bribery Convention at the OECD, our recommendation on public integrity, and more broadly, the public integrity standards is key in safeguarding the rule of law in both the immediate response to the crisis as well as in the long run and in the sustainable recovery. The OECD Working Group on Bribery, which is in charge of monitoring the implementation of the Anti-Bribery Convention and supporting members deliver on its obligation, has actually issued a public statement months ago to reaffirm the collective commitment of countries to fight foreign bribery under this convention, and highlighted precisely the bribery and corruption risks undermining the global response to the pandemic. So the working group has engaged in ongoing monitoring of potential COVID-19 related foreign bribery cases, as well as the impact of COVID-19 on existing foreign bribery cases. Member countries have shared some experience and best practices in the detection, investigation, and prosecution of foreign bribery cases, and the identification of emerging corruption risks and impacts of physical distancing measures on enforcement. As you know, a lot of the corruption cases, in particular foreign bribery, involve multiple countries, often international cooperation and legal assistance between countries, which often requires movement, travel of law enforcement officials to be able to gather the evidence needed to build a case, to investigate a case. And obviously the containment measures imposed by the pandemic to be able to manage it and circumvent it could have had an impact on the law enforcement officials' capacity to investigate. So in that regard, the working group will consider the issue of fights against foreign bribery during the future global crisis in the context of its ongoing review of the OECD anti-bribery recommendation, with a view to ensuring that the OECD anti-bribery instruments remain up to date and relevant. The findings of this analysis shows that, in fact, adequate resources for investigative agencies should be ensured. That's certainly a message that's important to make, to permit effective detection, investigation, and prosecution of corruption and bribery. And this actually leads me to my third point and the third dimension I wanted to flag here, which is to make sure that the corruption risks are also addressed in the context of economic stimulus measures. That means also in the context of the public sector engagement. As I mentioned earlier, the extent of the country's stimulus measures is in the trillions. This is a huge amount of money. Other measures to alleviate the impact of the crisis has also been on low-income countries. And the G20 leaders a couple of weeks ago adopted the debt service suspension initiative, which will help low-income countries keep some fiscal space to respond to the needs of their population and businesses in the face of this health and economic crisis. So these are very important measures that have been taken by our governments, and ensuring transparency and accountability in the use of these funds is really critical, including to maintain the trust of the population and to make sure that ongoing efforts to respond to the crisis are supported and welcomed by the population. So the OECD has collected country practices, especially related to social benefit programs, where countries have reported, for instance, increased fraud threats related to grants and schemes intended to support businesses and employees, of course, during the COVID-19 crisis. These can take the form of false or misleading information to obtain benefits, or establishing fake companies to apply for benefits for businesses. So these have been not just risks, but actually threats sometimes materialized in certain countries where these have been detected that need to be carefully considered. In our view, qualitative and quantitative risk assessments can help identify fraud risks and support decision-making processes. Again, here, internal audit functions are critical, and they can help, for instance, identify fraud risks through analytical techniques such as data mining or data matching. Talking about innovation earlier, using digital tools can really be helpful in trying to detect those threats and to highlight control weaknesses and trends that may suggest fraudulent activity or abuse. Finally, as I mentioned, it will be critical to ensure the highest standards of integrity and good governance of companies benefiting from these measures. And this is really an important message for governments to make, again, thinking about trust building and confidence of citizens that the money that has been put in the economy actually reaches who it should and supports businesses that need to. A recent OECD survey, in fact, of businesses in Southeast Asia as it stands, showed that many companies in the region, about 40%, in fact, intend to tighten up their business integrity policies as a result of the pandemic, and will be investing in third-party due diligence, internal audit, and training, both internally and for companies in their supply chains. This is extremely positive, although 40%, well, one could discuss the number in terms of whether it's positive or not. I think it's a good signal. That said, though, this is an announcement, but at the same time, companies will have to do that on a shoestring. 29% of companies are reporting reduced budgets for business integrity. So as they, of course, expressed the will to make sure that they have strong governance systems in place to manage those risks, at the same time, the resources allocated to the mechanisms internally to deliver on that are reduced. So this is really something that will need to be carefully looked at. And again, making sure that law enforcement officials have the right resources to address it is in and of itself a signal to companies that governments will not move away from and lower the standards of integrity they're expecting from their companies. Finally, we've seen that in the response to the crisis, this has led in many countries to a greater role of state ownership in the economy. This is very important to also keep in mind, as it is critical that state-owned enterprises uphold the highest standards of governance. At the OECD, we have developed some years ago anti-corruption guidelines for state-owned enterprises, which provide guidance to states as owners to ensure that ownership arrangements are conducive to integrity, that state-owned enterprises adhere to good integrity practices, and that accountability mechanisms are integral to SOE sectors. This will help ensure that state ownership does not become a source of distortions to competition and trade. So this is another element where the risks exist and where good governance principles and standards for state-owned enterprises are really critical. Finally, the last element of risks that we have identified that I think is also remains quite important as we're moving in the next phase of the management of the health crisis, including looking at vaccines, is the risks of illicit trade, including global trade in counterfeit pharmaceutical products. The OECD has issued a report that was pre-COVID though, but quite helpful in that context, together with the EU Intellectual Property Office on counterfeit medicines, which shows a growing risk in this area, which continues, of course, to be amplified during the current crisis. A number of enabling factors for illicit trade and effective countermeasures has already been identified by the OECD Task Force on Countering Illicit Trade. Anecdotal accounts show that current crisis has also activated organized crimes that penetrate businesses and take advantage of emergency measures and lower public trust in governments, emphasizing precisely the need for international cooperation in that context. And this would lead me, I'm also conscious of time, to my next and last slide, which is making sure, since we're in a global conference now, I think it's important to highlight and stress the need for international cooperation to tackle corruption, to maintain integrity standards as high as possible. And here, so the OECD has worked this year in the context of the G20 with the UNODC, the World Bank in particular, and the FATF, looking at the links between corruption and other economic crimes, including organized crime, which remains and is particularly relevant in the context of the crisis, of this crisis, and how international cooperation frameworks could be enhanced and strengthened to face those risks. What we have seen is that by leveraging the interlinkages between corruption and other serious economic crimes, the fight against corruption can be reinforced. In particular, by making use of, where appropriate, broadening the toolkit available to detect and to investigate corruption and related offenses and to recover stolen assets, by involving a broader range of authorities, nationally and internationally, in anti-corruption efforts, and by identifying and dismantling the networks that facilitate or use corruption. So this is particularly important for all relevant tools, to put relevant tools into action. For instance, information sharing between and within countries may not always be adequately proactive or systemic. Robust mechanisms in information sharing that include safeguards for due process and the protection of fundamental rights can help combat different forms of economic crimes. To give you an example concretely, the use of tax information in the detection of other crimes, such as foreign bribery, could be strengthened. In fact, we had found that only 2% of foreign bribery cases had been detected by a financial intelligence unit and only 1% by tax authorities. So one of the messages here is to make sure that there is a strong collaboration within the different agencies of a country and between countries themselves to make sure that we can leverage all the tools necessary to fight corruption. So I would like to stop here. In this last slide, I just highlighted the various standards that governments have developed within the OECD that can help address all these risks, including in the exceptional context of the COVID crisis, for your information. So let me stop here, Chair, and thank you for the invitation again.
Okay, Ms. Nesla, thank you so much for your wonderful, excellent presentation. If I may sum up your key messages, I would say in this challenging time, every country needs a very comprehensive strategy or approach which ensure the core public values such as integrity, inclusiveness, and resilience, especially in the process of public procurement. And secondly, you have also touched upon the issues of bribery, and you also come up with the possible key action measures for countries in the world. And secondly, and last but least, you also suggest some of the mitigation measures could be adopted in many countries in terms of tackling fraud threats and illicit trade, etc. And in conclusion, you also highlight the significance of international cooperation in tackling corruption. Okay, thank you ever so much for that. And 저희 시간이 너무 부족해서 바로
So we don't have enough time, so we will move on to the last presentation. Mr. Lee Gun-lee, Vice Chairperson from the IACC, and he will talk about the COVID-19 government actions and South Korea's strategies. Please welcome him with a big round of applause. Good afternoon. I am Lee Gun-lee from the Anti-Corruption and Civil Rights Commission, and I'm the Vice Chairperson of Chairperson. COVID-19, which broke out early this year, has been changing our daily life in a number of sectors that we have taken for granted in a dramatic and fundamental way. And COVID-19 is a wicked problem that is extremely difficult to be solved, and as the source of the outbreak has not yet been clearly identified, and it needs to be responded with different measures in a variety of fields. So this wicked problem of COVID-19 is putting all countries and various communities around the world to the test to see how well they are coping with certain disaster. Fortunately, the responses of the South Korean government and people to the coronaviruses are perceived to be highly effective, and some applaud this excellent K-quarantine. Although we are making substantial progress, I think we need to be humble before a great power of the nature. Today, I'd like to discuss some lessons the South Korean government has learned in responding to the pandemic and how we can apply these lessons to successfully deal with corruption, which is another wicked problem like COVID-19 and a hard-to-cure disease to a nation. The newly emerged COVID-19 and corruption share some similar characteristics, as both of them are uncertain and constantly evolve and transcend national borders and need a holistic approach. First, about uncertainty. Despite global research efforts, it is still unclear where the virus came from and how to treat it. And although there are some plausible theories, it may take considerable time to solve these questions. In addition, COVID-19 has a long incubation period of up to 14 days, so an infected person can spread virus unknowingly. And there have been many studies around the cause of the responses, the corruption too. However, as different countries and societies have different norms and practices and ethical standards, The same behavior can be interpreted as corrupt in one nation, while it can be perceived as socially acceptable in another. And corruption also can be caused by not only public officials, but also anyone, including general public, businessmen, and politicians. An American economist, Gary Becker, a recipient of the Nobel Prize in Economics, claimed that since the corruption is related to the level of activities of government, when the government completely seizes all the activities, the structure of corruption will disappear. As such, corruption is an extensive issue that cuts across all corners of society, and we don't have any magic bullet to resolve all this. Therefore, COVID-19 pandemic and corruption share the similar characteristics of uncertainty. Second, it's about continuous evolution. COVID-19 infection is caused by an RNA virus, and one of the characteristics of RNA virus is that they mutate fast while copying genetic information to reproduce inside the host body. Compared to DNA viruses that store genetic information in DNA, RNA viruses have more than 1,000 times higher rates to result in mutations when replicating the information once. As viruses mutate, they can easily evade existing treatments that have been studied or developed, having humanity to solve the puzzle that is immensely complex and where pieces of it continues to switch their location. Corruption shares the similar characteristics as COVID-19 in this regard. Traditionally, cash, jewelry, and other tangible goods were major means of corruption, and since the regulations for receiving and offering money and gifts were introduced, unconventional means of corruption have emerged, including intangible benefits in transport, accommodations, and entertainments. Privilege such as employment opportunities or Bitcoin or other virtual currencies that guarantee anonymity in transactions. Furthermore, as I mentioned, the level of tolerance for corruption varies by countries and society, so an effective policy in one society would turn out to be unacceptable or completely ineffective in another. We can easily find such cases in the corruption scandals involving political funds or the defense industry. I believe as COVID-19 and corruption constantly evolve, we need a more comprehensive and multifaceted approach in resolving these two wicked problems. Third, we transcend national borders. They transcend national borders. COVID-19 has not limited itself within the border of a nation, but rather reached beyond countless borders of other nations to become a pandemic, reminding us of the fact that the world is connected as one global community. In thousands of years of human history, trade and travel have sustained the flows of goods, capital, and people between nations, and it brings us to a globalized community where countries develop their economy and culture while being mutually dependent on one another. All the putting up barriers in airports and seaports could temporarily slow down the spread of the pandemic. It could not be a fundamental solution. And these measures also gave a fatal blow to the economy of each nation and posed a serious threat to the daily lives of citizens in many countries. Even though a country works hard and makes progress in controlling and preventing disease, the impacts of the coronavirus pandemic are ultimately shared across the globe, which makes international solidarity and cooperation all the more important. The same goes for corruption. Corruption is no longer a domestic issue, but a transnational problem that affects all societies and economies. As the schemes of acts of corruption, including tax evasion, bribery, and irregularities that go beyond national borders, are ever becoming sophisticated, international cooperation in preventing and resolving corruption has become a must, not an option. To support this, the global community has adopted and implemented international agreements such as the United Nations Convention Against Corruption and OECD Anti-Bribery Convention. The final characteristics they share is that they require a holistic approach to be mitigated or resolved. Anyone may come to think of developing vaccines and treatments as a only way of solving the COVID-19 pandemic situation. But in reality, we require more to respond the spread of the disease. First of all, we need development and distribution of test kits for rapid testing, unimpeded production and supply of masks and other personal protective equipment, and appropriate healthcare environment to treat patients, all of which create a physically enabling environment to contain the virus. However, what is equally important is to create an intangible environment. That is, we set obligations that all members of society are required to follow in relation to disease prevention and control, including standards and rules on disclosure and isolation about people infected or contacted with the virus. So we put in place behavior guidelines, including one that might partially limit one's rights. Finally, we as a community reach an agreement and accept all obligations and guidelines. In other words, responding to COVID-19 requires not only participation of the healthcare, the forefront and response efforts, but also engagement and attention from the entire member of the society. That goes for corruption too. Just as it is important to detect and strictly punish corrupt convicts, it is crucial to tackle loopholes in the law and system that enable and give rise to acts of corruption and to systematically prevent them from occurring through regular monitoring. Taking a step further, we need an approach to encourage the society as a whole to make a change by lowering the level of tolerance against corruption among members of the society and educating them so that anti-corruption ethics are deeply rooted in the community. Now, the similarities between COVID-19 and corruption in mind, I'd like to move on to the lessons learned. Scholars in South Korea claim that the recent pandemic has come with a wide range of challenges to the government's traditional bureaucracy and administration. They raised an issue, especially around the way of policy decisions are made and implemented, and of policy tools are explored and selected, as well as cooperation across different ministries and agencies and with the private sector. They stated that we need an alternative in approaching these challenges. Responses to COVID-19 vary by governments. As Director General Bae Kyung-taek presented earlier, South Korea's response strategies can be summarized as testing, tracing, and treatments, or 3T, where we focused on rapid testing, tracing, and managing suspected COVID-19 cases and treating patients. I want to compare and draw a conclusion from the Korean government lessons learned in responding to the pandemic and its effort and experiences to cut the crucial tie of corruption in terms of selection of policy tools and implementation of policies and public-private partnership and citizens' engagement.
First is the speed in selecting policy tools and implementing them. Upon the first confirmed COVID-19 case was reported in Wuhan, China, the Korean government issued an emergency warning and updated the level as blue, attention, and soon upgraded the emergency levels to yellow, caution, on January 20th, with the first domestic confirmed case reported, and to orange, alert, on January 17th with 4 new cases, and to red, severe, on February 23rd with the surge in the number of cases. The government promptly put disease prevention and control measures based on 3T strategies in place to prevent excessive numbers of confirmed cases that would put a strain on the healthcare system. This timely response allowed South Korea maintain the case numbers under control of its medical system and curb increases in the death toll. It is important to make policy decisions and implement them in a swift manner in the fight against corruption. As mentioned earlier, corruption evolves in many different forms. If failing to understanding the significance of the issue quickly in an early stage, where signs of corruption begins to emerge, and failing to develop and execute countermeasures in advance, structural corruption in a society is in many times exacerbated and to the point where it requires considerable cost before being resolved. For example, when Korea was recording high rates of economic growth in the past, money or gifts offered and accepted and approval in inspection procedures of building construction projects were implicitly tolerated to speed up the process for obtaining a permit upon the project completion. Although the practices of bribery became substantial risks to the safety of the construction structure with increasing scales of buildings or civil engineering projects, fundamental measures to address this problem were not developed, which ultimately led to dreadful accidents such as the collapse of Seongsu Bridge and Sampong Department Store. Changes in the economic and social structures and advances in technology tend to expose the seriousness of an issue that used to be ignored. In some cases, measures devised to address corruption lead to another problem. It is crucial to identify these types of emerging challenges in advance and timely develop and carry out countermeasures. Second lesson is preventing mistakes through learning. Timely responses to COVID-19 was the result of Korea's efforts in organizing response system for infectious diseases since the MERS outbreak in 2015, and strengthening and improving manuals, institutions, and resources so that they can be promptly adopted in various situations on the ground, such as testing and isolating those with suspected COVID-19. It was fortunate that we went beyond of keeping records of experiences learned from the policy failures during the MERS crisis, but to turn them into policies that can be implemented on the ground. Policy suggestions raised after the MERS outbreak, including increasing negative pressure rooms and epidemic intelligence service staffing, enhancing cooperation with the private sector to develop test kits for new infectious diseases, and elevating the status of the Korea Centers for Disease Control and Prevention, were translated into concrete institutions put in place in reality, and these played a critical role in preventing and controlling the recent coronavirus outbreak. When it comes to the fight against corruption, learning from past failure is vital. Through learning, we were able to target our efforts to institutional improvement in 229 areas vulnerable to corruption, and its monitoring of those areas, as well as training personnel in the areas, thereby improving inappropriate practices and wrong perceptions in a short period of the last 10 years. Korea also suffered from illegitimate hiring practices in the public sector where improper influence was made. However, the past 3 years of continued investigation, institutional improvement, and follow-up efforts on the establishment of new institutions on the ground have made considerable progress in addressing such practices. It is a significantly important lesson for anti-corruption policy to turn knowledge acquired into institutions by identifying the root cause of an issue and developing countermeasures to promptly respond should the identical or similar problem occur. Lesson number 3 is building public trust by sharing information in a transparent manner through the use of information and communication technology. Biological disasters like COVID-19 increases anxiety among members of a society. In such a case, government's ability to swiftly, timely, and publicly share information and effectively inform the public about risks plays a critical role in managing the situation. From early on in responding to COVID-19, the government was proactive in communicating with the public about essential information, such as the number of confirmed cases and deaths by region, where the confirmed cases have been characteristics of the virus, and personal precaution measures, and all of these provided the opportunity for the public to put their confidence in the government's disease prevention and control policy. And South Korea's advanced ICT infrastructure, too, substantially contributed to the efforts to overcome the emergency posed by COVID-19. Based on public data released in real time, several mobile applications were developed and used. One of them was the Corona Map. It tracks the locations where people infected of COVID-19 have been, and there were also mask inventory apps that provide up-to-date inventory data. The inventory data on publicly distributed face masks was disclosed as public data, and based on these data, mobile applications were developed by both the government and citizens. It became a successful example of cooperation model between the public and private sector in solving problems. A growing number of publicly used facilities are introducing QR code-based entry loan entry log for visitors. It was designed to provide transparent information on infection route for confirmed patients, share information about where the virus patients have been, and identify potential patients, and protecting privacy and the limitations we witness in the process, however, will be the challenges on which we need to ponder and reach a social consensus going forward. As for anti-corruption policy, ICT has played a major role in enhancing transparency through e-government project, various systems such as the government service portal, gov.kr, the online petition platform for citizens e-people, and the public contract website CONAPS were built to standardize procedures and processes in the government, prevent abuse of power and arbitrary processes. Lesson number 4 is people's voluntary engagement. If the members of our society didn't make voluntary efforts to put precautions and social distancing into practice, COVID-19 quarantine success would have been half-made only with the government's activities. Disease prevention efforts by individuals, such as hand washing and mask wearing, and measures to minimize the risk of the transmission through social distancing were included in the government's COVID-19 response guidelines and were promptly distributed, and there are a major factor that reduces the reproduction number, or R value, which is the number of people that one infected person will pass on a virus to. So the voluntary participation in social distancing was really important. Let me briefly restating what I have presented. The Korean government's responses to COVID-19 can be summarized as in the following 4 keywords: speedy action in making policy decisions and implementing them, institutionalization of lessons learned, building public trust by sharing information in a transparent manner through the use of information and communication technology, and expansion of citizens' engagement. The basis of realizing these 4 factors is good governance of a nation or a society. There seems to be no shortcut in attaining good governance. There is a saying in Korea that goes, "When in a hurry, take the long way around," which is equivalent to the English proverb, "Haste makes waste." It reminds us that when we are in a hurry, if we don't stick to the basics, but instead pursue short-term gains and only, we would end up in great failures. I'd like to end my presentation by dreaming of a future where we have defeated not only a biological disease of COVID-19, but a social disease of corruption by having the government, civil society, and all members of our society remain together.
Thank you very much. You said that corruption and COVID-19 are all the wicked problems, so there should be more than the government intervention. And another interesting aspect is that due to the similarities of the crop and COVID-19, like similarities and transnational phenomena, we need a holistic approach to tackle both problems. And you also said that all this possible with the international cooperation, and you conclude your remarks by sharing 4 measures and recommendations. Due to the time constraint, we weren't able to give enough time. If it was an offline meeting, we were able to have enough time to get questions and comments. Even so, although it is an online session, we had one question, and it goes to Mr. Bae Kyung-taek, Director General of Planning and Coordination. So, can you answer to this question? The question
We
is,
have one question from Germany. 그와인돌린 도민께서 질문하셨는데 아까
so it's from Germany,
발표하실 때
named
한국의
Derby.
코로나 대응 전략이 매우 효과적이었다고
And you
하셨으면서
said that the
거기서
Korea's
이제
COVID-19
이 세
response was
가지
very
핵심 전략이라고
effective, and you talked about the 3
말씀하셨었는데,
T.
이 그와인돌린 도민께서는 궁금한 게
And Mr. Domin wondered regarding tracing, regarding content tracing. Some foreign reporters or foreign people worry that it could infringe the privacy of the individuals.
이러한 외신의 보도
In some the foreign reports in journalists said that it could violate the individual privacy. So what do you think about this? And in order to protect the individual information, you said that you utilize some IT technologies. And what kind of technologies there are, and how long did you take to develop such IT technologies? And in Korea, we have advanced IT technologies and good infrastructure. And does Korea have any plan to share those the lessons with other countries? Thank you very much for your good question and comment. And before answering to your question, I need to tell you the current situation. So to come to here, I had to take bus, subway, and I also need to transport. And in order to do so, I don't need to use cash from the wallet. Everything is possible with the credit card, just like Oyster card in the UK. We have a separate transportation card, and we used to use that. And in addition to that, we used credit card, but for lazy people like me, we have a very combined the function of the transportation card. So within the credit card, we have a transportation pass system. So I think about 80 to 70% of Korean people use the credit card for mass transportation. So it's not like we came up with a new, brand new technologies to deal with this COVID-19. We used existing technologies. For example, if I'm a confirmed patient through the testing and I took a cab, and there might be another person in a cab, and I used a credit card. So through the credit card information, I can know that the cab number or the driver's identity, so that driver can know that he was in close contact with a confirmed patient. So for that, we used the advanced technology, and that's one example. The other example is that the Korea Disease and Control and Prevention Agency became an independent agency September 12th. And before that, we were just subsidiary of the Ministry of Health and Welfare. Now we are an independent agency. And there was another independent agency that came along with us. It's an individual information protection agency. It fell under the Ministry of Interior and Safety, and we decided to expand that agency as well to protect the individuals. And it was based on the enactment of the relevant laws and regulations. So the German person asked a question. So in the EU, there is a general data protection law and regulations. The reason that we came up with the agency to protect the individual information is similar to that practices in the EU. I think our practice is equivalent to the EU practices, and we got an advice from the EU Commission to come up with our own policy. I believe that way we could protect the individual information here in Korea. So some foreign press worry that the Korean government may violate the privacy, but in using the advanced technologies, we're not using them unlimitedly based on the existing laws and regulations to protect individual information. Based on the consent, we disclose the important information. So it's not like we had to spend a couple of years to come up with the brand new technologies. We used existing information. So then we need a cooperation from the credit card company or a tech company. So regarding the technology and information protection, I think we could share our practices with other countries, and not through the IACC, but through the OECD and other international organizations. I believe we can share and cooperate with other corporations, and the Korean government is open to such requests. Thank you very much for your answer. So we have 5 to 6 minutes left.
발제하시는 분들께서 좀 중요하다고 생각하시는 부분들을 서로
So I was
토론하실 수
wondering
있으면
if the panelists can discuss really important topics, or if you have any questions to each other, please do ask.
Well, Ms. Nazla Saula, if you have any questions to the panelists here, then feel free to ask any questions to the panelists here.
Thank you very much, Chair. And well, in fact, since you're opening the door to this question, I guess my question would be to the colleague who presented on the measures to ensure the adequate supply of medical equipment and in particular of PPE masks, which I thought was extremely interesting. And linking back to my own presentation where these are potentially where corruption risks may exist, I wanted to ask how were these risks addressed in the process that has been put in place and that my eminent colleague had presented.
이 질문에 대한 답변은 아무래도 김상봉
I believe that Mr. Kim
국장님께서
Sang-bong can
해주셔야
answer to this
사실
question.
지금 네즐라가 질문한 거는
So the question of Nesla was related to the supply of the face masks. So from the presentation of Nesla, we look into the corruption possibilities inside the procurement process as well as the transparency issue. So I think these two things cross with each other. So were there any risks inside the supply chain of the face masks, and what did you do to manage them?
그래서 마스크 수급 과정에서의 위기라 그러면 상당히 여러
When in procuring facial masks, we may have some risks. And as you pointed out, some issues were related to corruption. Some issues arise from the public sector, and basically the issue was there was a bigger demand than supply. So to get some private gain, the businessmen did not distribute masks and they raised the prices of masks, and sometimes they smuggled masks to export masks to other countries. And to respond to such crisis, we thought that we cannot solely rely on the market. It would be great if the market works well and meet the supply and demand request, but we thought that this is not the time to solely rely on the market. That's why we introduced the sanction or the regulations to stop people from hoarding masks and not distributing them. And that was the first measure. And second is that when we have a mask on the market, it should be equally distributed to all citizens. So if we just trust a distributor, it is possible that it could be unequally distributed to the rich cities, and it's not well distributed to local areas and remote areas. So the government decided to engage and intervene so that the mask can be distributed equally through some public contract or post officers or other designated distributors. And we also call for people's understanding, not so that they do not buy masks in mass. And also there are people who desperately need a facial mask, like people in a certain area. And as I said, it cannot be done by the government's effort. We need to make people understand why we are coming up with this measure and why we are introducing new law. So there should be a consensus and public acceptance, and that was the basis of our successful measures and policy implementation. And there was also detection and distribution control and understanding. It all worked. I hope that this could be an answer to your question and comment, and thank you very much for your question once again.
I'm wondering, Ms. Nesla, whether he answered the questions you raised. Are you happy
Thank
with
you.
his answer?
Pardon me. No. I think this is helpful to understand how this was, how the imbalance between the demand and the supply was addressed, certainly, and some of the risks associated to it. It's interesting to see and to compare. And well, myself, I'm not an absolute specialist on it, but I'll certainly take this back to my colleague to see how this was addressed in different countries and different systems. Precisely that have and how the relationship between the government and the public buyer with public sector providers has been organized, which is precisely where we see the crux of the risks that were heightened. So thank you for clarifying some of this, Mr. Kim.
아까 그 대화 도중에 아까
So during our discussion,
그러면 부위원장님도 함께 거기에 I
well,
think
Vice Chairperson,
Mr. Lee, he has got something to add on, so I will give him a mic. Okay.
네. 국민권익위원회에서 여러 가지 그 제도를
so from the
운영하고
ACRC, we are
있습니다.
operating different systems. Since 2014, we have been implementing integrity assessment since 2014, as I said. And that is how we are assessing the integrity level of the public organizations and especially public procurement processes. So we look into details so that we can make improvements continuously. And secondly, we have the e-procurement system, the market, to ensure the transparency. And this is open market. And thirdly, we have public interest reporting, which also includes any corruption-related activities that can be reported from the private sector. So we receive these reports from everywhere, and especially when we had the mask procurement process in early this year, there were some reports about possible corruption. So we could respond to them swiftly, and then we promoted this to the public to gain trust. And fourthly, we have open market procurement and many different complementary systems in place. And they were all possible thanks to public trust. Even though we were a little bit confused at the beginning, we could take prompt action to operate these systems altogether.
지금 말씀 도중에 그 배 조정관님께서도 아까 손을 잠깐 살짝 드셨는데.
So Mr. Bae wanted to make a comment while we're having a conversation.
KCDC, he has got something to say, so.
조금 전에 질문하신 거 관련해서 부위원장님 말씀하신
So regarding the question, I agree to what Mr. Lee from ACRC said, and I'd like to add a couple of things. In Korea, public procurement in the health insurance pension system and medical supplies treatment system, it works independently. And when it comes to negotiation and contract processes, the stakeholders become isolated, so they cannot work together. So the part that involves in purchasing and the part that involves in contracting and negotiation are all separated, so that there could be good check and balance. So that was my comment.
I think three of our panelists answered your question. Yeah? 오케이. 혹시 다음 질문이나 코멘트가 있으신 분 있으시면
If there's any other
말씀해
comment or
주시면
comment or question?
네네.
예. 그 유럽의
May I
대부분
say
국가들
something?
같은 경우는 이제
So in most of the
자가
European
치료를 하는 것으로
countries,
알고 있어요.
I believe that patients are
저희는 이제 유럽의
treating
이제
by
그
themselves.
국가들이 하는 것과는 다르게
But
별도의
unlike
격리
European
시설,
countries,
아까 말한 이제
we
그
have separate
임시
quarantine
기초 시설을
facilities.
설치해서
They are
감염
temporarily
확산을 좀
established
막는 그런 역할을 하고
to
있다라고
prevent
평가를 하고
the spread
있는데
of the
유럽이
virus.
최근에 이제 이렇게 그 확진자가 많이
And we see an
증가했던
increasing number of
아마
confirmed
자가
cases in
치료도
Europe.
하지 않았을까라는
And I was
생각이
wondering
들고,
if this
이런
self-treatment
관점에서
was one of the reasons.
공공시설 중심으로 해서 생활치료센터를
So
운영할 생각.
I was wondering if there is any plan to operate this kind of temporary treatment center.
So, Ms. Nestle, have you got the question? Since you are in Paris, 질문이 전달된 건지 되게 궁금한데, shall I translate into English?
Did you understand the question?
Sorry, I think there was a glitch. I couldn't hear it. My apologies. Could you repeat that?
지금 누가 통역하고 계세요? 제가 영어로 얘기해달라고. 영어로.
실장님 하시는 게 나을 것 같아요.
Okay. I think there is a question raised by Mr. Director Lee from Ministry of Home Affairs in Korea. His question was about, I would say, it's sort of different approaches to a response this COVID-19. Since you are in Paris, he is wondering, since you have a sort of patient, then those patients tend to stay home and get treatment at home, or he or herself goes to hospital or clinic and get a treatment. Unlike Korea, in Korea we have a special clinic or unit or complex where we accommodate all those patients into the same complex, and then they would all get the very standardized treatment from medical, I would say medical staff. So what could be the possible reason for your approach, which is just leave it to individual and getting treatment and everything? He suspects that there could be the sort of a main reason behind this widespread across the European countries.
Thank you. You're putting me on the spot.
I'm sorry.
Because this is not an easy question, and certainly, as I'm not a representative of the French government and the decision that they have made to manage the health pandemic, it's very difficult for me to respond. Perhaps just to make the point as a French citizen and living here, just to clarify, perhaps that. I think between the first and the second wave, there has been also different approaches in addressing it. The testing, tracing, and tracking has been implemented very heavily, in particular in the second phase. People who are either confirmed cases of COVID-19 or contact cases are asked to quarantine themselves, which they have. As you know, the second phase of confinement has been taking place in France for the past couple of weeks now, to precisely address the concern of the high rise in COVID crisis after the summer. So let me stop there, because this is really not my area of expertise, and I'd rather not provide a speculative answer to that and confuse you, but that's certainly a conversation to have, in fact, certainly for epidemiologists and health officials to exchange with you. So if you'll allow me, I'll just stop there.
I would say we fully understand that. And then why he was very curious about your approach or different approach, I would say he's in charge of dealing with this COVID-19. He's the sort of a director of Ministry of Public Safety and Interior Affairs in Korea. So he is bound to be curious about European different approaches. So I would say please to understand us. So, okay. That was not my intention to put you in the spot.
No problem at all. No problem at all. This is a very fair question, actually, and I think an interesting one to have. I'm just not in the best person to ask. I apologize.
No, it's okay. 혹시 다른 코멘트나 질문 있으시면 좀 말씀해 주세요.
So is there any question
or
or comment?
If you have any further questions, you feel free to ask or comment. Well, okay, I think that's it. Okay, it's been a long day and a long session. And 장시간 동안 토론해 주시고 발제해 주셔서 감사합니다.
So thank you very much, all participants.
For participating in this session. And everybody, thank you so much. And stay safe and well. Okay. Bye-bye. Thank you so much. 감사합니다.
Yes, once again, thank you so much for taking your time and our busy schedules. And that was very interesting topic. I believe it was very highlight topic for all of us. So we'd like to take more questions and hear from all of you once again. But unfortunately, we don't have enough time. But I believe this is not the end. We will talk about this topic in near future. So I'd like to introduce the next session, the Plenary 3, Collective Action for Trust and Integrity from 1 p.m. Greenwich time and 10 p.m. Korean time. It will start at that time. So please stay tuned and see you then. Thank you very much.
Bye, Desala. Thank you so much. 왜 갑자기 나보고 경시 통역하라고 그 여자한테 너무 출첵했어요.
고생하셨습니다.
고생하셨습니다.